Imagine waking up with an inexplicable tingling sensation around your mouth. You brush it off, thinking it's just a minor irritation. Days later, painful sores appear, leaving you anxious and confused. Could it be herpes or something else? Herpes is a common yet often misunderstood condition. It's important to dispel the myths and get to the facts. The aim here is to provide clear, comprehensive information. Herpes is more common than many people realize. According to the World Health Organization, around 67% of the global population under 50 have HSV-1, the virus primarily responsible for oral herpes. HSV-2, causing genital herpes, affects about 11% of the global population. These statistics highlight the widespread nature of herpes and its potential impact on public health. The stigma surrounding herpes often exacerbates the problem. Many people feel isolated or ashamed, preventing them from seeking the help they need. This essay aims to break down these barriers, offering support and understanding to those affected. Recognizing herpes early is vital. Misdiagnosis can lead to inappropriate treatments and prolonged discomfort. Knowing the difference between herpes and other conditions can save you time, stress, and potential complications. Understanding the significance of herpes in terms of health and well-being is the first step. Knowledge is power, and this information can empower you towards better health decisions. There are many myths about herpes, leading to confusion and misinformation. One common misconception is that herpes only affects those with multiple sexual partners. In reality, herpes can affect anyone, regardless of their sexual history. Simple skin-to-skin contact can transmit the virus. Another myth is that herpes can be spread through toilet seats or swimming pools. Herpes viruses are fragile and do not survive long outside the human body, making such transmission highly unlikely. Understanding this can alleviate unnecessary fears. Many people believe that visible sores are the only indicator of herpes. However, the virus can be active and transmissible even without visible symptoms. This is known as asymptomatic shedding and underscores the importance of regular health checkups. By debunking these myths, we can foster a more informed and supportive environment. Dispelling misconceptions is crucial for accurate diagnosis and treatment. Recognizing the symptoms of herpes is essential for early diagnosis and treatment. Herpes symptoms can vary widely, but some common signs include painful blisters or sores, itching, and flu-like symptoms such as fever and swollen lymph nodes. Oral herpes, HSV-1, often manifests as cold sores or fever blisters around the mouth. These outbreaks can be triggered by factors such as stress, illness, or sun exposure. In contrast, genital herpes, HSV-2, typically causes sores in the genital or anal area, accompanied by pain during urination or intercourse. It's important to note that symptoms can be mild and go unnoticed. Some people may experience only a single outbreak, while others might have recurrent episodes. The variability of symptoms can make self-diagnosis challenging. If you notice any of these symptoms, it's crucial to consult a healthcare professional. Early diagnosis can help manage the condition effectively and prevent transmission to others. Section 5. Misdiagnosis. The common culprits. Herpes is often mistaken for other conditions, complicating the diagnostic process. Common culprits include pimples, ingrown hairs, and other skin infections, which can resemble herpes sores. Understanding these differences can help you seek appropriate medical advice. Conditions like canker sores, which occur inside the mouth, are frequently confused with oral herpes. However, canker sores are not caused by the herpes virus and are not contagious. Similarly, genital herpes can be mistaken for conditions like yeast infections or bacterial vaginosis, which also cause itching and discomfort. Shingles, caused by the varicella zoster virus, can produce blisters similar to herpes. However, shingles typically affect one side of the body and follow nerve paths, whereas herpes sores are more localized. Accurate diagnosis is crucial. If you're unsure about your symptoms, consulting a healthcare provider can provide clarity and ensure you receive the right treatment. Section 6. Backed by research, expert opinions. Medical research provides valuable insights into herpes and its management. Studies show that antiviral medications can significantly reduce the frequency and severity of outbreaks. Experts recommend early intervention to manage symptoms and prevent complications. Dr. Anna Wald, a leading herpes researcher, emphasizes the importance of awareness and education. Understanding herpes and seeking timely treatment can improve quality of life, she notes. Our goal is to reduce stigma and encourage proactive health management. Research also highlights the psychological impact of herpes. Support groups and counseling can be beneficial for those dealing with the emotional aspects of the condition. Building a supportive community can make a significant difference. Expert opinions and research underline the importance of knowledge and proactive care. Staying informed and seeking professional advice are key steps in managing herpes effectively. Steps to take if you suspect herpes. If you suspect herpes, confirm the diagnosis and begin treatment. Schedule an appointment with your healthcare provider. They can perform tests to detect the herpes virus. Avoid intimate contact to reduce transmission risk. Use barrier methods like condoms. Discuss treatment options with your doctor. Antiviral medications can help manage symptoms. Educate yourself using reliable sources like the CDC and WHO. Section 8. Personal stories. Real-life experiences. Sarah, a 28-year-old graphic designer, shares her journey with herpes. When I first noticed the sores, I was terrified. I thought my life was over, she recalls. But after seeking medical advice and joining a support group, I realized I wasn't alone. Sharing my story helped me cope. John, a 35-year-old teacher, had a similar experience. I mistook my symptoms for a minor skin infection. It wasn't until I saw a doctor that I got the correct diagnosis. The medication helped, but the support from others in my situation was invaluable. These personal stories highlight the importance of seeking help and finding support. Many people feel isolated when diagnosed with herpes, but connecting with others who understand can make a significant difference. Real-life experiences remind us that herpes is manageable. With the right treatment and support, you can lead a healthy, fulfilling life. Section 9. Engaging with the community, Q&A and sharing. Engaging with others who share similar experiences can be enlightening and comforting. Many questions arise when dealing with herpes, and finding answers can be empowering. Common questions include how to manage outbreaks, prevent transmission, and cope with the emotional aspects. Online forums and support groups provide platforms for sharing experiences and advice. Websites like the American Sexual Health Association, ASHA, offer resources and community support. Participating in these groups can provide practical tips and emotional encouragement. Encourage others to share their experiences. Hearing different perspectives can offer new insights and coping strategies. Your story might help someone else feel less alone and more understood. Engaging with the community fosters a sense of belonging and support. Together, we can break the stigma surrounding herpes and promote a more informed and compassionate approach. Section 10. Conclusion. Prioritizing health and wellness. Understanding herpes and its impact is crucial for managing the condition effectively. By recognizing symptoms, seeking medical advice, and engaging with supportive communities, you can navigate this challenge with confidence. Summarizing key points. Herpes is common, manageable, and nothing to be ashamed of. Misconceptions and stigma should not prevent you from seeking the care you need. Early diagnosis and treatment are vital for managing symptoms and preventing transmission. Prioritizing your health is the best action you can take. Stay informed, seek support, and don't hesitate to consult healthcare professionals. Your well-being is worth the effort. Inspire yourself and others to take proactive steps towards health and wellness. Remember, you're not alone in this journey. Together, we can promote understanding, support, and better health outcomes. Explore reliable health resources, join supportive communities, and subscribe for more health and wellness tips. Your health journey is important, and taking the first step today can lead to a healthier tomorrow.